wife consultation station. Scenario: you are Dr. Fatima, a surgical doctor at local hospital. Today you have been asked to speak with Mrs. Matt, who asked to speak to your consultant Mr. Baker. Mr. Matt, her husband, was admitted a few days ago due to abdominal swelling and was scheduled for CT scan to further investigate his condition. However, technical difficulties with the hospital CT machine have caused delay in obtaining the necessary diagnosis images. Mrs. Matt is understandably concerned and frustrated, and you need to address her worries and provide her with information and support. Hello, Mrs. Matt. I'm Dr. Fatima, one of the surgical doctors. I apologize for the delay in seeing Mr. Baker. You are not Mr. Baker, are you? So from the start, your patient is upset and angry. You need to calm down and calm your patient. No, I'm not. I'm very sorry. He has been called for an emergency. I'm here to see what's wrong and talk to you about what I can do for you. I will tell Mr. Baker that you were here and I can arrange another appointment to meet him. I understand this is a tough situation. And change your tone. I understand this is a tough situation. Your husband came in a couple of days ago with abdominal swelling for 6 weeks and was sent for CT scan. Unfortunately, we are currently experiencing technical difficulties with our CT machine. Why is the CT scan required? We know your husband has abdominal swelling due to fluid accumulation, some of which was analyzed and revealed cancer cells. We need the CT scan to determine the type of cancer, its origin, and its extent. Is there any alternative? As a temporary solution, we can perform an ultrasound scan to assess
his liver
and the presence of the suspicious spot, as well as to estimate the amount of fluid. Another option is an MRI, which can provide similar information to a CT scan. However, we will need Mr. Baker input on this. Our last resort would be to transfer him to another hospital with a working CT scanner. If this is a small hospital, why didn't you transfer him to a suitable hospital from the start? I apologize for the inconvenience, Mrs. Matt. So always mention your patient name a couple of times as we said. And I didn't put it from the start just to remind you here. Mention your patient name. While we may be a smaller hospital, we typically complete all necessary investigation for our patient within 2 weeks time frame. Rest assured, we will not leave him untreated, even if a transfer become necessary. Is it a cancer? To confirm a cancer diagnosis, we need more information about its origin, stage, and treatment options. At this point, all we know is that cancer cells were found in the fluid analysis. This is the answer. Even if she asks you a couple of times, 6 times, 4 times, just provide this answer. Do you think he will need surgery? We consider surgery for cancer where there is a potential for improvement. However, in Mr. Matt's case, the advanced nature of his abdominal swelling suggests an aggressive cancer. In such cases, surgery may not provide significant benefit and may only increase discomfort. But he could not breathe well right now. Yes, his difficulty breathing is likely due to the excess fluid in the abdomen compressing his lung. I will discuss with Mr. Baker the possibility of drainage of some fluid and prescribing medication to alleviate his symptoms. His brother is not here right now. He's traveling. Should I tell him? So that's a tricky question. I understand your concern, Mrs. Matt, as we said. It may be best to wait for the CT result before informing him. Once we have more information, we can discuss the next step and involve his brother as needed. Okay, that makes sense. Last question, doctor. I think he had cancer because of his work environment, and I want to file a complaint against his employer. What do you think? Now, that's a very tricky question. I understand your point, so always emphasize on the point that your patient mentioned and reassure him that you are considering their point. But this is out of my scope of practice. You can speak with the legal team. they will be able to help. Any other questions? No, doctor, thank you. Always summarize to your patient. Why? Because you have 2 minutes or 3 minutes. It's better to use them into your advantage. To summarize, Mrs. Matt, your husband has abdominal swelling containing malignant cell. Unfortunately, our CT machine is currently out of order, but I have explained the alternative to you. We are here to support you throughout this difficult time. And when you say that, change your tone. We are here to support you through this difficult time. And if you have any questions or concern, please do not hesitate to contact me. Thank you for your understanding. Thank you. Then the next station is cancelled operation arthroscopy. Good morning, I'm Dr. Yasin. I'm one of the surgical doctor working here. Is it my turn now for the operation, Dr. Yasin? So your patient started aggressive. Calm down and calm your patient down. Remember, they are trained to do that. Nothing personal. So calm down. I understand you've been waiting for your knee operation. Unfortunately, the operation cannot proceed today. What do you mean by that, doctor? I apologize for the inconvenience, Mr. John. So you mention your patient name. Be more friendly. Your knee condition is important, but we've had an emergency case requiring immediate attention. Would you call my consultant, Mr. Babika, please? I'm sorry, but the consultant is currently occupied with an emergency case. I won't be able to reach him at the moment. I need another consultant to do it now then. I understand your concern, but bringing another consultant would delay the process further, as they would need to review your case from the scratch. So could you do it? I'm sorry, but I cannot operate without supervision. So when you say that sentence, don't say it like, I'm sorry, but I cannot operate without supervision. That's wrong. You say this way, I'm sorry, but I cannot operate without supervision. Okay, then give me another appointment. I'm unable to provide you with a new appointment right now, but I assure you will prioritize scheduling your operation as soon as possible. Are you joking? You have all the problems but not a single solution. Mr. John, you always keep mentioning your patient name. Maybe 2, 3 times are enough. I understand your frustration and I will do my best to ensure that your next appointment is prioritized without any further delays. How can I work now? I can provide you with medical note explaining the situation to your employer. Additionally, I can prescribe medication to help manage your pain and discomfort. Can I walk on my legs? While you may experience some discomfort, it's important to stay active with a non-weight bearing exercise. And by non-weight bearing exercise, we mean like swimming and cycling. And these exercises, they are non-weight bearing, which means they don't press on the joint. I can also refer you to the physiotherapist for further guidance. I need another medication for the heart pain. I will prescribe different painkiller for you. Please stop taking diclofenac as it may cause some stomach ulcer. Okay, doctor. Do you have any question? Yes, I'm not happy and I want to file a complaint. Yes, of course, that's your right. You can file a complaint via patient advice and liaison services. I'm really sorry for the inconvenience. So it's a tricky question. In this case, you may just say, yes, of course, that's your right. You can file a complaint via patient advice and liaison service and you stop here. But this is not complete. You still need to be sorry for the patient. I'm really sorry for the inconvenience. How the arthroscopy is done? Now he's asking you a different question. We insert a small device that contains a tiny camera into your joint. This way we will be able to visualize inside the joint. Then we will proceed with the operation. Any other question, Mr. John? No. To summarize, always you will find like 2-3 minutes at the end. Take advantage of these minutes by summarizing. To summarize, Mr. John, your operation has been postponed due to an emergency. Mr. John, there is no need to mention Mr. John again. I apologize for the inconvenience and we will be in touch soon to reschedule your appointment. If you have any further question or concerns, please don't hesitate to contact me or the nurse. Thank you for your understanding. Next station is total knee replacement. Scenario: Mr. Leon arranged for total knee replacement. He came today for his operation. What you need to do: answer the patient question and address the patient question. And this is exactly what you need to do for all the communication stations. Hello, Mr. Leon. I'm Dr. Saeed, one of the surgical doctor. I would like to talk to you regarding your surgery. Is that okay? Maybe he's not willing to talk to you to the surgery. If you notice, if the station mentioned that the patient requested you to talk to him, then the patient is asking for you to talk to him. In this case, the patient gave you already the consent and the permission. But in such case, you came to speak with him. Maybe he's not willing to talk. Maybe he does want to go to the toilet. Maybe he's not ready now. Maybe he's in a difficult emotional status. So you need to ask for consent. So the guideline and the criteria here: if the patient asked for advice from you, you just go and give the advice without permission, because the patient, by him asking, that means he's giving you the permission. But if you are going to speak voluntarily to the patient, then you need to ask for permission. Is that okay with you? Yes, doctor. Well, do you have any question or concern regarding this surgery? Yeah, doctor. Can you share how long the operation typically takes? The operation usually lasts a couple of hours, including anesthetic time and recovery. Are there potential complications I should be aware of? That's a good question. Look here. That's a good question. Yes, Mr. Loyan, you're mentioning your pain. So always encourage your patient by saying, yeah, that's a good question. Yes, Mr. Leon, and use this for all the communication. Some complications include bleeding, stiffness, pain, clicking, infection, and blood clots. After you mention that, that's a lot of complication, right? You may refuse going to the theater knowing this complication. You need to assure your patient. But don't worry, we will do our best to avoid these complications. For the pain, we will provide you with painkillers, and we will recommend a physiotherapist who will suggest suitable exercises for you. How will blood clot be prevented? Mr. Lyon, you always mention your patient name. I can't tell you how many doctors forget this part. Mention your patient name. You will appear more friendly, you will appear more sympathetic and more professional. It's crucial to stay hydrated, keep moving, wear your anti-embolism stocking, and make sure to take the blood thinners as prescribed. These steps are essential to lower the risk of blood clots in your situation. Can I have breakfast on the morning of the surgery? It's best not to eat anything at least 6 hours before the procedure. Clear fluids are allowed up to 2 hours before surgery. We'll prescribe IV fluids for you. Will I be under general anesthesia? In this case, you better delegate the job to the anesthetist. Your anesthetist will discuss your options. They will make sure you are comfortable and well informed about the process. How long will I need to stay in the hospital after surgery? The average stay is around 3 days, but it depends on your recovery before discharge. We conduct various investigations, including assessing your ability to bend your knee and get on and off the bed. When is the hospital follow-up? I'm glad you asked, Mr. Lyon. So you're encouraging your patient. Follow-ups are typically at 6 weeks and 6 months post-surgery in the outpatient department, with additional assessment by your GP at 2 weeks. When can I return to work? Mr. Lyon, I understand your worries. The timing for returning to work varies from person to person and depends on the nature of your job. We will assess your progress during the recovery period, and the medical staff will guide you when safe and appropriate for you to resume work. Factors such as your healing, mobility, and the physical demand of your job will be considered in determining the most suitable time for your return. Because if he's working in an office doing paperwork, that's totally different than someone working in a warehouse. So you need to consider that. How soon can I work after surgery? Physiotherapists aim to get You walking on the first day following surgery. Can I go swimming after the operation? Mr. Lyon, don't forget your patient name. Please wait until your wound is fully healed and you are confident in walking safely around wet areas. When can I start driving? Please avoid driving for at least 6 weeks until you are confident it's safe to do so. How soon can I travel after my operation? It's advisable to avoid air travel for 3 months after the surgery due to the increased risk of blood clots. For other travel, ensure regular movement. Mr. Leon, please note the swelling and redness around the knee are normal for up to 6 weeks. That's a very important point. And the knee may remain warm for a year. We will provide you with an informed booklet for further guidance. Mr. Lyon, do you have any questions? No, thanks, doctor. Mr. Lyon, I want you to know that we are here to help and support you. Feel free to reach out if you have any question or concern at any time. Thank you, Mr. Lyon. Thank you, doctor. So we didn't summarize because this is a bit long station, but if you have time, like 2 minutes at the end, summarize the case for your patient. Next station is colonoscopy. Scenario: Mr. Jack, a 54-year-old, for colonoscopy. When reviewing the clinic notes, it's observed that he has been experiencing rectal bleeding and weight loss over the last 3 months. Answer the patient questions and address the patient concern. Hello, Mr. Jack. I'm Dr. Anderson, a senior house officer. I would like to discuss the procedure that has been arranged for you. Is that okay? We're taking a permission here. Yes, doctor. Why are we taking a permission? Because we are the one who's talking to the patient. The patient didn't ask for us to talk with him. Can you share what you understand about the planned procedure so far? Certainly. From what I gathered, Mr. Babika wants to use a camera to investigate the source of the bleeding in my bowel. Yes, that's correct. He didn't give you all the information, so you need to explain more. The procedure is a colonoscopy involving a flexible tube with attached small camera known as endoscope. It will be inserted in your back passage. It provides detailed images of the bowel lining, helping us diagnose any issues. You will receive sedation through a vein and it's generally not painful. Also, you will be given laxative to see clearly. Any question about this? No, I understand. Will I be awake during the procedure? Mr. Jack, so mention your patient name. You will be awake but sedated, ensuring you won't mind the procedure or remember it clearly. Are there alternative procedures? Barium enema is an option, but it doesn't offer as much detail, and we can't take tissue sample for analysis. I think I will go with the colonoscopy then. Are there any risks? I understand your worries, Mr. Jack, so mention your patient name and change your tone. Don't say, understand your worries, Mr. Jack. Don't say it like this. Say, I understand your worries, Mr. Jack. Every procedure has risks. This includes sedation-related issues, bleeding from tissue sampling, bowel rupture, and notice here we didn't say perforation, and the possibility of incomplete procedure. But let me reassure you that mentioning these risks doesn't mean they will happen. This is a very important point. Whenever your patient asks you for risks and you mention all the risks, always make sure you mention these 2 sentences. But let me reassure you that mentioning these risks doesn't mean they will happen, and only skilled and experienced doctors are allowed to do such procedure. Can I eat and drink normally beforehand? To ensure clear view, maintain a low fiber diet and drink fluids 2 days before. The day before, stick to clear fluids. Should I take my blood pressure tablet on the morning of the procedure? Yes, continue taking your regular medication in the morning. What about my aspirin? That's a fantastic question, Mr. Jack. So encourage your patient by saying, that's fantastic question, Mr. Jack, or that's a good question. Due to the risk of increased bleeding, stop taking aspirin 7 days before the procedure. You can resume immediately after. One more question, doctor. How long until I get result of the tissue sample? The tissue biopsy result take 2 weeks. We'll schedule follow-up appointment in the outpatient clinic to discuss the finding. Any other concerns or any other questions? No. As we said, you will find 2 or 3 minutes at the end, always summarizing these 2 minutes. To summarize, Mr. Jack, you are scheduled for a colonoscopy in which a flexible tube with a camera will be inserted via your back passage. I discussed with you the benefit and the risk. I want you to know that we are here to help and support you. Feel free to reach out if you have any question or concern at any time. Next station, Jehovah Witness. Scenario: Mr. Robert, a 62-year-old, is scheduled for brain tumor excision. What to do? Explain to the patient the risk of the surgery. Ask the patient for the permission for blood transfusion. Hello, Mr. Robert. I'm Dr. Anderson, one of the surgical doctors. I would like to discuss the upcoming brain tumor operation with you. Can you tell me what do you know so far about the operation? I know I'm having an operation to remove a brain tumor. Yes, exactly. We are planning to remove the tumor, but it's a risky procedure due to potential bleeding. I would like your permission to store some bloods in case it's needed. Is that okay? I won't accept a blood transfusion due to my religious belief, even if it becomes necessary during the procedure. Certainly, I would like to discuss the potential risk if bleeding cannot be controlled during the operation. It may necessitate halting the procedure before complete tumor removal, elevate the likelihood of a severe stroke, and increase the risk of mortality. I know that, and I don't want a blood transfusion. So your patient is very clear. I totally respect your decision. To ensure complete understanding, could you please explain the information and risk associated with refusing a transfusion? So you want to make sure that your patient is aware. Yes, doctor, I'm having an operation to remove a brain tumor and I may need life-saving blood transfusion. I decided not to consent to any blood transfusion, even if it's a life-saving. And then you will have a discussion with your examiner. How can you ensure that the patient is capable of making this decision? I will perform full capacity assessment. I will make sure he is able to retain and analyze information. Whom would you notify about this decision? I would discuss his refusal with the neurosurgeon, anesthetist, and theater staff. What precaution can be taken? Even though he's not agreeing to the blood transfusion, there's a lot of things that we can do as a precautions. Pre-operatively, I will check the baseline hemoglobin and consider measures like erythropoietin, tranexamic acid, and IV fluids. Intraoperatively, we will focus on quick, precise procedure with a good communication between teams. Post-operatively, we will ensure hydration and monitor hemoglobin level closely. I would also document the refusal in the notes. How would you conclude the discussion? By asking the patient to recap the information and ensuring their understanding of all the risks associated with the operation. I will then request him to sign a legal document confirming his decision.